Thank you. Right. Welcome to our Finance and Performance meeting for February.
13. We've got 13.
Sorry?
We've got 13 here.
Yeah. Yeah, we were watching them come in the door, so we had a quorum, so that's good. Thank you. Right, we have apologies from Councillor Penrose and Philippina, who are on down south doing some work, probably stuck on that motorway.
The government needs to invest in that ticket in the interchange.
And Member Taipari and Deputy Mayor Hulse for lateness. Mayor Liam Brown and Denise, Councillor Crum for non-attendance.
I'll move those.
Thank you. Moved by Ross, seconded by...
Leaving at 1 o'clock if we haven't already finished.
Okay, right, early departure, fine. It's been moved. Have I got a seconder? Yes, Councillor Brewer. All those in favour?
Aye.
Against, carried. Thank you. Declarations of interest. I haven't received any. Confirmation of minutes of the 10th of December. Would you like to move those, Ross?
Yes.
And I'll second those. Thank you. All those in favour? Against, carried. Petitions, there's none. No request for public input. No local board requests. No extraordinary items. No notice of motion. And we do have some presentations from the Regional Amenities Funding Board. Can I welcome Vern and board members and his team. And first up, we have Greg from Auckland Rescue Helicopters. Welcome. Great, welcome.
Welcome, thank you very much.
Very nice to have some very positive news. Good, I'm sure.
Good, thank you very much, and thank you for giving me the opportunity to talk to you this morning. My name is Greg Barrow and I'm the CEO of the Auckland Rescue Helicopter Trust. The Trust is a clinically focused emergency service. It uses primarily helicopters as a means of transporting clinical teams to the scene of an accident or medical emergency, and then it carries the sick or injured back to a suitable hospital. It also provides a search platform for the Rescue Coordination Centre and the New Zealand Police. A small portion of our work is to fly medical teams to outlying hospitals to transport sick people either back to the Auckland Adult Hospital or to the Starship Children's Hospital. The Trust is based at Mechanics Bay, where it owns and operates 2 specially equipped emergency medical service helicopters. ARHT is a certified air operator in accordance with the Civil Aviation Act. It employs helicopter pilots and co-pilots, helicopter crewmen, advanced paramedics, and through an arrangement with the Auckland District Health Board, it provides doctors on the majority of its helicopter flights. The organisation is a registered charity governed by the Trust Board made up of 7 trustees. Chairman of the Trust Board is Mr Murray Bolton, and the trustees are Dr John McDougall, Dr Craig Marshall, Michelle Bogue, Ken Bagley, John Hawkesby and Bob Parkinson. The Trust receives a fee for service for the flying we do from either ACC, the Ministry of Health, the Rescue Coordination Centre, the New Zealand Police or a District Health Board. Because we are manned 24 hours a day, there are considerable fixed costs that are not recovered in this fee for service, and the Trust relies heavily on sponsorships, public donations and support from the Auckland ratepayers through the Auckland Regional Amenities Funding Board. The Trust has a dedicated fundraising team who generate funds through sponsorship, community fundraising, corporate fundraising, events, bequests and donations. The fundraising team are tasked with keeping the cost of fundraising at 20 cents in the dollar or less, and I'm pleased to be able to report that currently we are achieving a significantly better result than this. 70% of the missions carried out are in the Auckland wards. And because of the close proximity to the Coromandel Peninsula, we also provide services to the people of the Coromandel. In our application to the Auckland Regional Amenities Funding Board for financial assistance, we are careful to identify the costs associated with flying in the Auckland wards as opposed to the flying activity outside of Auckland. The ARHT works hard to be less reliant on the Auckland Regional Amenities Funding Board funding, and the grant that we will receive in the 2016-2017 year will make up approximately 3.5% of our total income. Of the 10 amenities, the Auckland Rescue Helicopter Trust receives the smallest amount of money from the Auckland Regional Amenities Funding Board. Of the total funds granted by the Auckland Regional Amenities Funding Board in its draft funding plan for 2016-2017, ARHT will receive 2.8%. However, we are very grateful for the support we receive from ARAFA, and to acknowledge this, I'm pleased to advise that the ARHT website recognises Auckland's Council as one of its supporters, and our helicopters will be soon be branded with the Pahutakawa motif of Auckland Council, and this will appear in our television series Code 1, which is being filmed at the moment and will appear later this year on Television 1. There are 4 key areas that the Trust is focused on at the moment. They are firstly securing the supply of doctors through the DHB on a long-term sustainable basis. The issue that we face is that the Auckland DHB is continuously challenged by the volume of patients visiting Auckland Hospital Emergency Department, and at times releasing doctors to fly on our helicopters is difficult. In the long term, while we would never look to employ our own doctors, we will make a greater financial commitment to the DHB to ensure a guaranteed supply of doctors. We acknowledge that the inclusion of doctors on our flights is not always necessary, but on the occasions that they are required, they make a significant difference to the patient outcome, and on that basis, the Trust is committed to providing them in the future. Secondly, we are keen to replace our ageing helicopters, and we've done a lot of work to investigate suitable replacement aircraft for our current helicopters, which are close to 30 years of age. Whilst these helicopters are maintained to a very high standard, we are continually facing maintenance issues that prevent helicopters being available for service. We've identified a suitable replacement, but we've made a decision after a trip that I did to Italy last year to let that type develop for the next 12 months before we commit to it, to ensure that it is a successful commercial helicopter that can be operated at a cost which is affordable. Thirdly, we're challenged by our facility at Mechanics Bay, from which we are based. The helipad is owned by the Ports of Auckland, and the Trust is eager to make some improvements to its operational base. The main issues that we have is that there is insufficient room to hangar both our helicopters, and because of the development of the port, the helipad itself at Mechanics Bay has a number of challenges that we would like to see rectified. We are waiting for guidance from Ports of Auckland as to what their long-term aspirations are for the land at Mechanics Bay, and we hope to have some clarity around this in March this year. There is potential that there will need to be a capital investment at Mechanics Bay, and some of this investment will most likely be the responsibility of the Auckland Rescue Helicopter Trust. The Trust is also concerned that the helicopter air ambulance sector as a whole in New Zealand is not as efficient as it could be, and we are actively involved in the Air Rescue Group, and this organisation is working with central government in an attempt to make improvements to the sector. There are 11 separate air rescue trusts in New Zealand, and each of them have administration and compliance issues that cause a lot of unnecessary duplication, and as the cost of compliance continues to increase, there are obvious savings to be made through unification and harmonisation. These are quite complex issues which I will not spend too much time on this morning, but needless to say, we are hoping to make some progress in this area over the next 12 months. Lastly, like all organisations, we are very focused on health and safety. We have done a lot of work to ensure the organisation is in the best possible shape it can be prior to the introduction of the new health and safety at Work Act, which comes into effect in April 2016. The Trust is committed to introducing a safety management system which will be accepted by the Civil Aviation Authority by the end of this calendar year. In principle, this is an advance on the quality management system that we already have in place, but under a safety management system, we will be required to review on a continuous basis the potential and consequences of risk in our operation and develop strategies and policies that mitigate risk. For the 12-month period to December 2015, the Auckland Rescue Helicopter Trust carried out 1,060 missions in its helicopters, and it dispatched its rapid response vehicle 58 times. This compares with very similar numbers for the previous 12 months. Because of the commitment to caring doctors and a commitment to the continuing education and development of our paramedic staff, there are unquestionably a number of people who are alive today that would not have been if it weren't for the services that this organisation provides. Since I spoke to you last May, we have continued to become a more clinically focused organisation with the emphasis not on the helicopter but on the patient. The RHT has worked actively in the review of the Auckland Regional Amendment Funding Act, and we look forward to working with the Funding Board to help implement the suggested changes that the review recommended. In closing, I would say that it is the aim of the Auckland Rescue Helicopter Trust to deliver to the people of Auckland a clinically focused, reliable, cost-effective rescue helicopter service, and this can only be achieved through the very generous support of its sponsors and the supporters such as the Auckland Council, and we appreciate your assistance. Thank you.
Thank you, Greg. We've got time for a couple of quick questions. Thank you, Councillor Cashman.
Yes, Greg. Mechanics Bay site, is that potentially under threat you'd have to shift, or it just needs some capital improvements?
No, I don't think it's under threat. I think that the issues are that we just don't have room and the helipad gets busier and busier, so we'd just like to see some improvements made to it.
Has that been costed out?
Not at this stage, because we need to make sure ports are happy that we proceed in that direction first.
Thank you.
Thank you, Kathy.
Thanks, Greg. Delighted the Puhutakawa's gone on to the helicopters. I wish it would go on to the trains and buses, but that's another story. My question is whether you'll make recognition of Auckland Council on the website. I was having a look just then to see about your funders, and there isn't really anything.
We do, I think, on our sponsors page, it's, the motif is there, and the Auckland Council is recognised amongst our key sponsors.
Missed it.
Okay.
Again. Thank you.
Thank you. Well, thank you very much, Greg.
Oh,
Very
it is,
full
look,
report.
it is.
Fantastic. Well done.
Okay, thank you.
I saw that.
Now we have Maritime Museum. Vincent, thank you. Welcome.
Thank you very much. Good morning, ladies and gentlemen. My name is Vincent Lipanovic. I'm the Director of the New Zealand Maritime Museum. Thank you very much for this opportunity to come and talk about the museum. Hui Te Aunanui a Tangaroa, the New Zealand Maritime Museum, is a nationally and internationally significant cultural heritage facility located in the Viaduct Harbour Precinct. We are kaitiaki of taonga that tell the stories of Tamaki Makaurau Auckland and Aotearoa New Zealand's maritime heritage. We connect Aucklanders with their past to better appreciate and inform the present and future. Our museum provides a portal for visitors, both local and international, to explore the cultural identity of our city and our nation, and to engage with the stories of our relationship with the sea. It's our mission to collect, preserve and interpret Aotearoa New Zealand's unique maritime stories through the hard work of staff and volunteers who help us develop and deliver our galleries, the Bill Laxton Maritime Library, 3 and soon to be 4 working heritage vessels, an engaging public program, quality education programs that ensure Aucklanders have access to our collection, as well as providing a major tourist attraction to the visitors of Auckland in downtown. Before I go any further, I'd like to take the opportunity to publicly thank and pay tribute to our volunteers. They're a huge, dedicated and remarkable resource, and we're very grateful to them for their hard work and passion. In the last financial year, New Zealand Maritime Museum benefited from over 45,000 hours of volunteer labour from a pool of over 200 volunteers who assist us as guides, hosts, collection assistants, shipwrights, model makers and masters and crews of our vessels. Obviously, this is a remarkable community resource that allows the museum to function at the level that it does. On a purely practical level, our volunteers are the backbone of our efforts to run